So we're going to talk about doing tube tapes today. You can see there's a piece of tape, okay, that's over top of the sticky part of the tape. This is basically to create a space for behind the head so that the tape doesn't stick fast to the patient's hair. We're going to slide this behind. The saline bullets that you see here are just to help so that the tape doesn't get all twisted and stick fast to itself. Okay, we're going to position the tape behind the patient's head so that the space where it's not sticky anymore is able to not stick to your patient's hair. Pull this up here. We're going to split the piece of tape in two. The pieces are extra long right now, so you have the ability to make them shorter when you get to that point, but we make them long because the one time you short yourself, you'll never do it again, ever again. Okay. So we're going to just wrap, so you want to make sure you get the sticky side wrapped to the patient's face. Make sure that you don't have any kinks, anything that will cause your patient to have any pressure injuries. Okay, once you get to that point, make sure you tab this. It's important that you put a tab on the end of this so it's easy to be able to pull that tape off. Your other piece that you see here, I'm going to use this to go ahead and anchor across your patient's face. Again, if it's too long, you can always rip the piece of tape here, making sure staying away from earlobes, things like that. Okay, one person's always responsible for holding the tube itself so you don't lose anything, because that's the last thing we want. Wrapping again all the way around. You have to move your fingers around so that the second piece of tape can be secured. Final piece of tape we have here. Cross anchor over top of the pieces of tape that we have already done. And again, tear off, tab the end again, and secure your patient's face. Your tube should not move anywhere. Make sure you still note that you can see the markings here where your patients are supposed to be at the gums and or teeth. And that's it.